and welcome to this month's Team Brief podcast. Today I'm in the new surgical simulation unit at Chorley. This fantastic new facility provides live links with some of our theatres so that our trainees can practice their skills in the safety of a lab and watch real surgical procedures taking place. The unit in the Education Centre will be used by medical students as well as our doctors, nurses and theatre staff to develop their skills. It has been funded using a generous bursary from the trustees of the Preston Postgraduate Centre, and it will help us to provide high quality surgical training. A big well done to everybody who's worked on this, and thank you to Mr Ian Ritchie, President of the Royal College of Surgeons of Edinburgh, who officially opened the centre. Okay, now an update on our financial situation. Last month, members of the board and I went to London to meet with Monitor for a progress review as part of the ongoing investigation into our financial governance and sustainability. Our revised financial plan was discussed and submitted and states that we will deliver efficiency savings of 22 million in the coming year. This is substantially more than the 9 million we had originally forecast we would make. We are acutely aware that not delivering the full 22 million in this financial year is just simply not an option. If we can't deliver the saving and balance the books, the consequence could be that Monitor removes or adds members of the board. We have got the opportunity to retain control over our own future, but we need to work together and act together now to make sure that we're all delivering the local productivity and efficiency targets and eliminating all waste at every level in the organisation. Margaret Pratt, the Finance Improvement Director appointed by Monitor, is working alongside us to challenge our decisions. She's asking very tough questions about many areas that we previously thought were untouchable, about the services that we provide, about staffing levels, and about business cases that we've already approved. Nothing is off the table. Every single one of us has to take personal responsibility for improving the financial position, or the consequence is that we will no longer be in charge of our own future. The board is being held to account by Monitor, and we are holding every member of staff to account for playing their part in turning this round, so everyone should expect to be challenged. We all have a role to play. And I've written a detailed Chief Executive comment about this and the actions that we need to take. It's on the homepage of the intranet. Please make sure you read it. This is for all of us to deliver at every level of the organisation, from the board right down to the shop floor. We now have a transformation and business delivery team who are working on developing a cost reduction programme. So if you've got any efficiency ideas, please contact the business delivery unit. There's a lot more information about this new team on the homepage of the intranet. Also on the intranet, you will find a list of master plan shortlisting events that are taking place over the next 6 weeks. Over recent months, some of our staff have been helping us to decide how we plan to deliver our services in the future. So we've had a long list of options, and we're now trying to narrow it down to a number of options that we need your help to decide which is best. If you wish to attend one of these shortlisting sessions, please contact Karen Thompson. Okay, let's have a look at our performance figures. We missed our 4-hour standard for the emergency department in August. This is mainly because of the capacity challenges that we have continuously faced since summer 2014. We're continuing to work with our health economy partners to try and improve patient flow, and we've taken actions that will have significant impact, but we just simply haven't seen the full benefits of these actions yet, as they're mainly in the longer term. That's why the principles of perfect 365 patient flow are absolutely critical. Please make sure that you know what is required and what is expected. And while we're talking about patient flow, there have been some myths surrounding the opening hours of pharmacy and when the team are available to support discharge. The inpatient pharmacy is open on both sites from 9 a.m, 7 days a week. There's a guide on the intranet for routine medicine supply requests. We did manage to achieve the 18-week incomplete pathway standard for July. Great achievement. We've been focusing on prioritising treatment for people who've been waiting for longer than 18 weeks, and we need to make sure that we continue to closely monitor the progress and the listing of all patients who've had lengthy waits for procedures and tackling any barriers to prevent further delays. Early indications show we've achieved 6 of the 9 cancer standards for August, but this is subject to validation. We had 2 cases of C. difficile, and that takes our total figure so far to 22, which is below our year-to-date objective. We achieved our standard for harm-free care for August, and we're now showing a patient safety briefing video on TV screens in patient areas. The short film has been developed to advise patients and their loved ones how they can help to keep themselves safe during their hospital stay. The safety advice looks at things like falls prevention, correct personal information, and discharge from hospital. Now, just a few other updates for you. This year's staff survey will be launched on the 28th of September. This time, we are running it entirely online so that all staff can access it via their email account on any PC. So look out for an email from the Picker Institute. The answers are anonymous and your feedback is vital to ensure that changes can be made to improve things for you and our patients. Please make sure you complete the questionnaire. The Staff Friends and Family Test is also currently live, so if you've been randomly selected to take part, please do fill it in. There's only 2 questions to answer. We've been scoring really highly nationally. We want to make sure it stays that way. There's also a survey from the temporary staffing team, which used to be known as the Nurse Bank. They're looking to expand, develop and improve our current service to meet business needs across the organisation in a bid to try and increase the number of bank workers and reduce agency spend. The team want to know your thoughts on temporary staffing, so please complete the short survey, and again, responses are anonymous. The Mars scheme is now closed and the applications are being processed. The Mars board will make a decision throughout September and applicants will be contacted via a letter sent to their home address. For further information about this, please contact Mike Austin. And finally, implementation of the sickness absence strategy is underway, and we're really pleased to see there's been a steady reduction in absence throughout Q1. Historically, we do have an extremely high rate of staff sickness, so reducing absence helps us to deliver the best possible patient care, so we've just got to keep the momentum going. We also need all managers to ensure that wherever possible, you record the reason for absence accurately so that we can look at what we can do to help people. And that's it for this month's podcast. Thank you for watching. Thank you for the team here in the Education Centre at Chorley for allowing us to be here today, and please join me again next time.